Welcome back. The U.S. Centers for Disease and Control and Prevention says it's keeping an eye on rising numbers of human parvovirus cases in the U.S. In today's Health Minute, Mandy Gaither has more on what you need to know about this viral illness.
It's called Parvovirus B19. Early this year, health officials in more than a dozen European countries reported unusually high numbers of cases there, and now the U.S. is seeing more of the viral illness, too.
This year so far, the increase in cases has been up to 20%.
The CDC says some who are infected with the virus will have no symptoms. Others may have a fever, headache, cough, sore throat, rashes, and joint pain. It can also present itself as red splotches on the face, also called a slap cheek rash, but this symptom is more common in children.
It attacks bone marrow cells, primarily red blood cells, or the precursors to red blood cells. So it tends to cause anemia.
OBGYN Dr. Gregory John Locksmith with Orlando Health says pregnant people, especially those with no previous exposure to the virus, have a higher risk of serious complications.
1 out of 3 cases, the mother does transmit the virus to the baby. Most of those babies don't have problems, but a small percentage, maybe 10 to 20%, can develop severe anemia, which can ultimately lead to intrauterine fetal death.
There's no vaccine to prevent a parvovirus B19 infection, but since it can spread through respiratory particles, practicing good hygiene can help prevent the spread. Cover nose and mouth with a tissue or your elbow when you cough and sneeze. Properly wash hands and clean frequently touched surfaces. For Health Minute, I'm Mandy Gaither.
The CDC says people with a weakened immune system and people with certain blood disorders are also at higher risk for severe illness if infected with parvovirus B19. The agency says to see a doctor if you have symptoms of the infection while pregnant or suspect complications from a parvovirus B19 infection.